We are discussing the infectious agents that are associated with diarrhea. And so far we have covered the bacterial infections. If you remember the invasive and the non-invasive types of diarrheas, and we'll keep talking about those for a longer period of time with the rest of the infectious agents that we are going to discuss. And today we will be discussing other agents of diarrhea or gastroenteritis, and those are viruses. And viruses, they play a major role in the causation of diarrheas as well, invasive and non-invasive types of diarrhea. Viral gastroenteritis is the most common viral viral infections in infants and children, and it's one of the causes of high mortality, especially among infants. And you will learn when you go to the clinical year, especially in pediatrics, when a baby develops diarrhea, you will calculate the amount of fluids that you are going to give to that baby. Otherwise, the baby could develop dehydration and death. So diarrheas in infants are extremely important here to treat as a duty of a physician. Viral diarrheas is the second most important and common here illnesses in children, usually after the upper respiratory tract infections. So when we talk about upper respiratory tract infections, it is caused by viruses until proved otherwise. And when a baby develops diarrheas, then the causative agent is a virus until proved otherwise. So this is extremely important to know. In developing countries, babies usually they die of dehydration caused by the diarrheas that are associated with viral infections. So it is really important here to treat these types of infections. It is estimated that almost mortality rate related to that can get to up 500,000 infants. They die every year because of dehydration and because of diarrheas. It is extremely then important to know these infectious agents that are responsible for these types of diarrheas. And you will see that the rotavirus is one of the most important viruses that are associated with these diarrheas, and then we will talk about others. And part of your duty as a physician is how to calculate the amount of fluids that you should give those babies to prevent the dehydration. So part of your job as a physician then to know the infectious agents that are associated with diarrheas, because if you know what is the etiological agent, then you have to treat. But the rule of the thumb in the treatment of diarrheas in general is to replace the water and electrolytes that has been lost by the infant. And those infants, they are extremely sensitive here to dehydration. And so if you do not here calculate properly the amount of fluid that you should compensate the baby with, usually the baby is going to die because of the diarrheas. So it is very important then to know those infectious agents that are associated with diarrheas. And remember that rotaviruses are the most common viruses that usually are associated with diarrheas in infants, usually less than 2 years of age. So when we say it is a baby who is having a diarrhea, and you think of an infectious agent, it is a rotavirus until proved otherwise. So it's extremely important to know that. Then you have to know the others. So rotaviruses, usually less than 2 years of age, and then younger than that, then you have to think of other viruses, like for example adenoviruses. Here serotypes 40, 41, 38. Those are important causes of diarrheas. Also we have the Khaleesiviruses. Khaleesiviruses, the bulk of viruses that are associated with diarrheas are RNA viruses. So it's extremely important to know that. Very few the DNA viruses. So you should know when we talk about any virus associated with diarrheas, whether it is a DNA virus or an RNA virus. We have the Khaleesiviruses, for example. One of them is called the Norwalk agent, and the Norwalk-like viruses, and those generally are called small round viruses in general. So RNA viruses, single-stranded as well. And we have astroviruses, and the astroviruses usually also are RNA viruses that they look like a star in general. Astroviruses, and those they are infecting older children compared to the rotaviruses. Some others we can call them like small round viruses that and there are so many. We will be talking about those, and also the coronaviruses that we have right now and is just distributed all over the world. Patients, whether adults or babies, they could develop here diarrheas. So I want you to remember that the coronaviruses in old people that are immune compromised, that they could develop diarrheas as well. So very important to know that. And also we have others like the toroviruses can be associated with diarrhea. So when we talk about viruses of diarrhea, we talk about here the viruses of that diarrheas usually are caused by viruses in general. Then in order to make the diagnosis, you have to exclude other infectious agents. That means bacterial, parasitic, intoxications, and so on. And if you exclude those infectious agents that are causing diarrhea, then you have to think of viruses, including the coronaviruses. So, rotaviruses and others. This is how we call that, including the coronaviruses as well. We have other viruses that also can be isolated from the gut and might not be associated with diarrhea. So it's not all the time viruses that are isolated from the gastrointestinal tract can be associated with diarrhea. Like, for example, polio viruses, poliomyelitis. Here goes into humans through the gastrointestinal tract. It's very important to know that polio viruses can go through the GI tract. Coxsackie viruses like Coxsackie A and Coxsackie B viruses sometimes could be associated with paralysis as well. Ecoviruses, enteroviruses, viruses of that causes diarrheas also. Serotype from 68 to 71. Hepatitis A virus, don't forget that, can go through the gastrointestinal tract. And hepatitis E viruses also can go through the gastrointestinal tract. And of course, here other viruses of DNA in origin, like adenoviruses, from serotype 1 to 39. Adenovirus, very important to remember, that can be associated with diarrheas and goes through the gastrointestinal tract. And also the reoviruses. Reoviruses those are double-stranded RNA viruses that are segmented. Reoviruses can be associated with diarrheas. We have many others, like those are the ones that are found in the gut. We call them as opportunistic, can be associated with opportunistic infections, like the cytomegalovirus, for example, can be seen in the gastrointestinal tract. Also, the herpes simplex virus, for example, varicella zoster virus, and even the HIV virus here can infect the gastrointestinal tract. So it is so important to know the viruses that can be associated with diarrheas, and the viruses that can go into our body through the gastrointestinal tract and might not be associated with diarrheas. Very important to remember that. Rotaviruses then are the commonest viruses associated with diarrheas in infants, usually less than 1 year of age. And you have to know that we do have common features between viruses associated with diarrheas. Maybe the most important one, that they are naked viruses. So naked viruses usually are the ones that are associated with diarrheas. The rotaviruses, they are naked and they are double-stranded RNA viruses. Here they are large, around 80 nanometers in diameter, and compared with the other viruses of diarrheas. Also, they are found in other animals here, like in mammals, for example, and birds, as well as here, and are those ones can be associated with diarrheas in humans. Usually they are associated with diarrheas in animals. So the ones that are associated with diarrheas in humans, usually they come from human rotaviruses. So when we talk about diarrheas, then in infants less than 1 year of age and 1 to 2 years of age, it is rotaviruses unless proved otherwise. So around 50 to 80% of all cases of viral gastroenteritis are caused by these viruses. Usually they are endemic, but can be responsible for occasional outbreaks, like in prisons, for example, or nurseries, and so on, and wherever schools, wherever you have infants, for example, you could have an outbreaks. Also causes diseases in all age groups. When we talk about rotaviruses, usually we are talking about infants less than 2 years and 1 to 2 years of age, but can be present in all in children of all age groups, even in adults. But most reverse symptoms here, and neonates sometimes can be infected with these viruses. Young children as well, and some they can be asymptomatic, for example, of children caused by these viruses as well. Common can be in adults as well. It is rare, but you can see them in adults, and even older children could be asymptomatic infections as well. Can be common, as we said, in all age groups, even in patients that are over 60 years of age. It's unusual, but can be present in all people as well. Up to 30% here is the mortality rate. So when we talk about mortality rate here, and why those children they die of here these types of viruses, it's because of diarrheas and the dehydration that will be associated with these diarrheas. So I want you to remember that people they die of these viral infections because they get dehydration. Very, very important to remember that. Especially if you have other clinical problems, like, for example, malnourished children, and children that their nutrition is compromised for one reason or another, and they develop diarrheas because of these viruses. Usually they die. Around 1 million children, they die every year because of these infectious agents. So I want you to remember that almost 500,000 babies, they die every year because of these viruses. So we said that then the most common virus associated with diarrheas in children, especially less than 1 year of age, is usually the rotavirus. And as I said, it's a double-stranded, naked, segmented RNA viruses. 80% of the population have shown antibodies against rotavirus by the age of 3. So it shows you how frequent children usually are infected with the rotavirus. It is more frequent during winter time, not summertime. So during winter, you have colds here, as well as the diarrheas can be associated with that. And I want you to remember that now we do have coronaviruses, and the coronaviruses can be associated with diarrhea. So you could have respiratory type of infections and diarrheas at the same time caused by the coronavirus. The main mode of transmission is usually by the fecal oral route. Feces that comes into food or water and ingestion by that. So general hygienic measures here are extremely important to prevent these types of infections. What about respiratory droplets? Yes, we said that coronavirus can be associated with here diarrheas here, so that comes usually from respiratory droplets. So it's uncommon, but you have to think of that as causes of diarrheas. The incubation period is short, usually 1 to 2 days. I mean, maximum 1 to 2 days is the incubation period, and then the patient starts to develop diarrhea, starting with an abrupt onset of abdominal pain, cramps, and then diarrheas will be associated with that. Those patients have fever, usually low grade fever. So it's not necessary that patients will have fever. In Japan, they call it hakuri. Hakuri, it means white stool. Here can be associated with these types of diarrheas. So diarrhea, white stool, sometimes even here dark color stools, usually whitish stools is usually the rule of the thumb in those types of patients. And when patients develop these symptoms, usually the diagnosis is so simple. And always we talk about any exclusion of other infectious agents, and we have to exclude other infectious agents like bacterial, for example, or parasitic or protozoal infections to start with, and then you have to do to detect the antigens of these viruses, and we do that by immune electron microscopy. You add antibodies here into the stool specimens, for example, against these agents like these viruses, or you can detect those by serological techniques like ELISA assays, for example. Of course, after you make the diagnosis by ELISA or immune electron microscopy or immune assays in general, the most important thing in the treatment is to replace the water and electrolytes to prevent the dehydration. And as I said, you will learn, part of your job is how to calculate the amount of fluids that you have to give to those patients to prevent the dehydration. And after you make the diagnosis by these assays and immune electron microscopy and so on, you replace the water and the electrolytes, as I said. How can we prevent this? We do have a live attenuated vaccine is now available for children, and they say that these live attenuated vaccines are very effective in preventing these types of infections. Always remember that diarrheas and infections caused by these viruses is very common in third world countries. Problems related to water and food contamination with fecal material. So if you prevent this and break the cycle of infection, then you can prevent these types of infections. So the Khaleesiviruses are much smaller than those of the rotaviruses. We call them small RNA viruses, characterized by their surface morphology, consisting of here holes, here particles around 35 nanometers here in diameter. So it's much smaller than the rotaviruses here. It is associated mainly with epidemics also, and sometimes endemic as well. Outbreaks like those of rotaviruses, gastroenteritis, although here occasionally responsible for endemic areas. So sometimes it is endemic in certain areas. So epidemic as well as endemic areas at the same time. Like مثلا are present in a city called Norwalk, so they used to call it the Norwalk agent, Norwalk type viruses. Vomiting is the predominant here feature of these viruses, not just diarrhea but also vomiting. Majority of children, they do have antibodies like the rotaviruses against the Khaleesiviruses by the age of here 3. So very common in areas that are endemic with these Khaleesiviruses. And the same thing here, we diagnose those by immune electron microscopy. So it's not just electron microscopy, but immune electron microscopy. And also by the antigen detection. It is sometimes difficult to make the diagnosis because they have much smaller size than those of the rotaviruses. So the Norwalk agents or the Khaleesiviruses are much smaller than the rotaviruses. Small RNA viruses with here ragged surface, almost half the size of the rotavirus, 35 nanometers in diameter. Also it's classified, we call it the Khaleesiviruses, of course. So Khaleesi virus is much smaller, half size that of the rotaviruses. Always associated with epidemic outbreaks of gastroenteritis in adults, more commonly here affected than in children. So children less than 2 years of age, usually it's a rotavirus. Older, it could be Khaleesi viruses, and much smaller than that. Associated with the consumption of shellfish. You know, the shellfish, many people, they eat those semi-raw or steamed, and so might not be inactivated, or the heat might not here kill these infectious agents. So the shellfish here then could be a source of infection to adults. Just foods through fecal oral route in origin. Yeah. Aerosol as well, spread like the others, as well as fecal oral route in origin. This is like most of the infectious agents here that causes diarrhea. Always we name it the Khaleesiviruses, usually because of the winter here type of a disease. Usually comes in winter, like those of the others, rather than in summer, with vomiting being the prominent symptom, not just diarrhea, but vomiting more common than diarrhea. So very important here to remember that. Vomiting, then diarrhea. So the diarrhea becomes much milder than those of the rotaviruses. And many of those patients that are infected, they will develop antibodies against these Khaleesiviruses. They could develop later in life here rather than early in life, like in the United States, for example. Around 50% of adults are usually seropositive by the age of 50. And half of people in the United States, almost, if you test their antibody level, they will be positive for the Khaleesiviruses almost before the age of 50. And the diagnosis is like the others, by electron microscopy, by PCR identification, or immune electron microscopy as well, like the others that we have talked about. The other virus that is associated with diarrheas in adults as well as in children are the adenoviruses, and this is a DNA virus rather than an RNA viruses. So we call it an enteric adenovirus because it causes diarrhea. An enteric here adenovirus. It is naked DNA virus. As I said, the common feature of all viruses infecting the GI tract that they are naked. The viruses around 75 nanometers in diameter. It's fastidious enteric adenovirus types and serotypes like serotype 40 and serotype 41. They're very, very common in causing diarrheas. Usually are associated with gastroenteritis. So the adenovirus is then associated with diarrheas are serotypes 40 and serotypes 41. Associated with masses of endemic gastroenteritis, usually with young children and in neonates as well, and can cause associated here outbreaks as well. Possibly the second most common viral cause of gastroenteritis. تقريبا 7 to 15% of all here endemic cases are caused by adenoviruses. Similar here cases, similar disease here to rotaviruses as well. So it's common like those of rotaviruses. Most here people, they have antibodies against here enteric adenovirus by the age of 3. So very common. Many people, they get exposed to that and they develop antibodies here to these adenoviruses, serotypes 40, 41. And it's the same. It's diagnosed by electron microscopy or by the detection of the adenovirus antigen in feces by ELISA, for example, or any other assays, detection of the antigens in stool specimens. So always when we talk about viral infections to the GI tract, we are always talking about contamination of food or water with these viruses. And of course, the prevention is always taking good hygienic measures, hands washing, washing the fruits and vegetables, boiling of water in areas that are endemic here. So these are general measures that we use in here controlling these types of infections. The other viruses associated with diarrheas are the Astrovirus particles, and the Astroviruses, it looks like a star in shape. So star-shaped viruses, as simple as that. They are small RNA viruses. Here seemed because of the star-shaped, and the Astra here viruses, it means a star in Latin, so star-shaped viruses. The surface structure of the virus looks like a star. It's around 28 nanometer in diameter, so it's a small virus compared, of course, to the rotavirus, which is the largest of them all. It's associated with cases of endemic gastroenteritis, associated with young children and neonates as well, and can cause occasional outbreaks in areas that are their water or food is contaminated with these viruses. It is responsible for up to 10% of cases of gastroenteritis in general. Similar here disease to rotavirus and adenoviruses in general, in cases of how people they get infected through water or food. Most people, they do have antibodies by the age of 3. So very common. That means people are infected with these viruses. And it is the same, diagnosed by electron microscopy, and also sometimes it's very difficult to diagnose because of its small size and compared to the other viruses. Also, when we are talking about viruses that are associated with diarrheas, is not to forget our friend, the coronavirus. So coronaviruses can be associated with diarrhea. This is extremely important to know. And they are RNA viruses, as you know, with a corona-like here appearance. Corona means like a crown. They have appearance, and not convinced that a virus was associated with infection to the upper respiratory tract and lower as well, can cause here gastroenteritis, but it is one of the common features of coronaviruses is the development of diarrheas. So it is very, very important to know. We have other viruses, we call them small round viruses. Small viruses like particles with a smooth surface around 22 to 28 nanometers in diameter, and may possibly be parvoviruses. Here, enteroviruses, could be an enterovirus, or cubic, here bacteriophages could be responsible for such type of an infection. Here, occasionally seen in the feces of endemic or epidemic cases of gastroenteritis. So occasionally can be associated with an epidemic or endemic types of infections. So here when we talk about then viral infections to the gastrointestinal tract, always you have to remember usually infants and children, and dehydration, and always remember the rotavirus is the most common virus that is associated with diarrheas infants in less than 2 years of age. So we always talk about rotavirus plus others, the Khaleesiviruses and the others. So it's extremely important to know the significance of these viruses and how to make the diagnosis, and how we have to exclude the common agents of diarrheas, whether as we said bacterial or parasitic here, before going into viral in etiology.